Hello everyone. We are here with Dr. Sachi, and today she will be talking about what is HPV and who all needs to get vaccinated about HPV. So, without any further ado, let's get started. So, ma'am, will you please introduce yourself to everyone?
Sure. Hi, Purvi, and hi, everyone. Thanks for having me. And as you guys have probably heard a couple of our talks, I'm the obs and gynae. And of course, I've been with Pregamed for a bit, and we're here to spread awareness and get all women informed about their own health, which is really important. Currently, I am working as a consultant in Dubai. I have also worked prior to this in India and in the United Kingdom. So I think let's get to the topic. Of course, we all have heard of HPV. So Purviya has a couple of questions, which I think we've got from audience popularity. So let's talk about it.
So, ma'am, the most common question we all have that most of us don't know about is what is HPV? Could you just brief everyone about it?
Sure. So HPV, or called the human papilloma virus, is a type of virus like the common cold. Basically, there are about 100 different types of this HPV virus. I mean, we all know about coronavirus now and its different types. So very similar to that, of which about 40 of them are actually sexually shared. And from these 40, two of them, that is type 16 and type 18, are the dangerous ones. They can put us at a risk of having cancer of the cervix or neck of the womb, right? Now, we're not here to scare anyone. We're just here to spread information and awareness. But these are what the facts say. Now, there are a couple of other types of this particular virus again, which can cause other infections, like, for example, warts, which I'm sure a lot of people would have heard of. And last but not the least, a few of these types of the virus are actually linked with cancers in other parts of the body, like the vagina, the vulva, the anus, the penis in males, and also the back of the throat. So, very important for all of us to understand what this virus is, how it spreads, and how, of course, we can protect ourselves from it.
Yes, ma'am. So basically, we all have heard about what this virus is. Now, who all needs to get vaccinated for this? And is
Sure.
there any criteria for people?
Okay, so excellent question, Purvi. We would go according to recommendations when it comes to vaccinations. So if we stick to the CDC guidelines, which are international guidelines in a way, it is recommended that all teenagers in the age group of 12 to 15 should get vaccinated against the HPV. We also have guidelines which have been developed in India, which resonate with the same, right? There is also recommendation that between the ages of 15 to 45, both women and men can be offered the vaccination, right? When it comes to women, it is definitely recommended, as it can protect them from the most common cancer, that is the cancer of the cervix or the neck of the womb. The protocol would vary. So if you're below 15, you would need 2 doses. After 15, it goes to 3 doses. The first dose, the second one a month apart, and the third one 6 months after. Again, all of this would be very individual, right? So before actually getting your vaccination, it would be important that you have a quick consultation with your gynae or your healthcare provider to make sure that it's safe for you to go ahead.
Okay, moving on to the next question is how does this vaccine work?
So it's always important to know how things work and why we should take them. So I really like this question. Now, like other vaccines against how they guard us against different kinds of infection, similarly, what the HPV vaccination does is it develops immunity or antibodies in our body against that particular virus. So if at any point in our life we do get exposed to that particular virus, our body already has protection against it. right? So we would be able to fight it in a much better way, and hence reduces our risk of getting that virus and in turn getting its complications, right?
Well said, ma'am. And the next question, which is mostly like asked by people, is: are there any side effects, or who should refrain from taking this vaccine? Well, that is great, ma'am. And lastly, I would like to just conclude this by asking: are there any tips you would like to share, which can be helpful in the regular prevention of HPV?
So thankfully, not any known major side effects. Of course, if you're allergic to certain additives which are a part of all vaccinations, it would be recommended that you avoid it. However, the occasional muscle ache or pain, mild fever, sometimes mild nausea are the most commonly seen side effects. So it is considered safe for all teenagers who are otherwise medically fit. If you're immunocompromised or you're pregnant, it would not be recommended, right? Otherwise, most women and even boys for that matter are okay to take it. Sure, Purvi. So very important for all our listeners to follow safe sex practices. Important to always use condoms when you're having a new partner or even with your regular partner, right? That is the best way to prevent any kind of sexually shared infections, including the HPV. Secondly, all girls, please have your pap smears regularly. We've spoken about this earlier, starting from the age of 25, once every 3 years till you hit 45, after which once every 5 years. A simple swab test, which can catch any changes in the cervix or the neck of the womb early, right? And last but not the least, if you've been detected with the HPV, please don't panic. 8 out of 10 women at some point in their reproductive life, that's between 15 to 45 roughly, do test positive for it. It's that common, right? But what you can do is help your body get rid of it, like you would help your body get rid of a common cold. Build on your immunity, avoid smoking, and continue safe sex practices. And probably the next time you get tested, you're going to be negative for it. I hope that helps, Purvi.
Yeah, thank you so much, ma'am, for sharing these insightful tips. And we would like to thank you. We would like to thank you for sharing all these tips and how HPV works. Thank you so much for your time, ma'am.
Thank you, Purvi. Thanks for having me.